the last speaker for the first session, Dave MacCutcheon. Sorry,
You did.
my
You got it right on the first try. It's MacCutcheon. Thank you.
okay, perfect. And he is the COO of InfoBionic, and he will be speaking about modular approach to diagnostic ECG wearables. The floor is yours.
Thank you. Thank you for inviting me, and thank you all for attending this morning. Appreciate the opportunity. So, what I want to do first is set the stage a little bit about ECG wearables and what I'm going to talk about. Um, so, ECG electrocardiography has two real markets or two methodologies today. And the gold standard for diagnostics is the medical version of ECG. And so essentially that is collecting up the electrical tiny signals that come from your heart as the heart muscle depolarizes. And this energy passes out to your skin in various vectors away from the heart. And then our monitors can pick those up using what are called electrodes. And you've probably all either seen that, and that's why I have the little picture of the waveform when you see either on a medical show or you've been to the doctor and they put you on the ECG. And each of those little waves represents a vector of the electricity coming off your heart. Now, there's another technology that's out there that's used mostly for off the shelf, or we'll call consumer goods. And this is a photoplethysmograph, the PPG. It's really great for heart rate trackers, gets your heart beats. It actually uses the change of the blood volume in your cardiovascular system and the small skin vessels to actually do the heartbeat, count it. It's been proven to be very accurate for heart rate tracking, for heart rate variability, and actually has some applicability for limited arrhythmia detection for atrial fibrillation. But today's focus will really be on ECG, the medical devices, the prescription devices. So kind of what we're doing and what we're doing a little bit different. I think to roll back a little bit to talk about the history of ECG is that when I talk about the monitor that we're going to be talking about that you wear, a prescription monitor for ECG, a lot of people refer to those as Holter monitors. And the Holter was actually invented in 1947. So that's the image on the far left, or I guess you're right. I'm trying to figure out how that works. On your left, that's Dr. Holter trying, which actually was an electroencephalogram and electrocardiogram all in one in 1947. If we look at the picture on the right, that's a pretty typical Holter monitor from the era from about 1970 up through about 1999. And then in many cases, these types of Holter monitors remained prevalent as an initial diagnostic tool until about 2010. And even in some cases, they're still used. This specific device type is still used around the world. But this is kind of the ideology of it. If we look at what's really happening today, and I'm going to say current state of the market, and I'll clarify, this is really U.S. market focused here. And that's because there is a different delivery method and approach for the way that the U.S. Healthcare system and the way electrophysiologists and cardiologists order and prescribe the device in the US, which is slightly different than the models used throughout Europe and the rest of the world. When we get into talking about the types of exams a little bit, which is beyond just the Holter monitor, which is the mobile cardiac telemetry devices, those are relatively expensive in both the devices and the need to monitor the patient in real time or near real time for 30 consecutive days. What we're seeing in the market, and you see the picture here, and it looks like a lot of patches. What's happened is the U.S. market has shifted toward this, what we call a one lead patch strategy. Most of the larger companies have developed these. Most of them are non-communicating, meaning that the patient sticks this patch onto their body. Either it's mailed to them or they get it at the office, and then they mail it back, at which point someone is reading the data off of it and generating a report. There are some of these that are communicating, but what we generally find is that in the market is that most of these are single use case, meaning they do one type of exam. And the single lead actually has some challenges in that if it's collecting any noise in the signal, it's an undiagnostic ECG. So you can see the squiggly lines there on this particular slide. You can see that's really, as we would say, there's really just no good sinus rhythm. There's just no good QRS complexes to determine whether or not this patient has a normal rhythm or not. So this is kind of state of the market US. It's a growing market. It's very large. There's about 50 vendors in the United States overall providing various wearable ECG devices that are cleared by the FDA. Some on a very small scale and some at a very, very large scale. So just give you a little bit of background on that. So let's talk about our approach and our modular approach to diagnostic ECG. So our system has a couple of components. So our system really starts with, and let me go to I just realized I'm looking at a different slide, so I apologize. This was the slide before where I was talking about the individual patch devices. So I've got to keep my screens in sync here. This is the patches that we'll see most predominantly in the market that I just talked about. You can see here on this ECG strip that it is pretty noisy and there's no clean complexes. So let's talk a little bit again, like I said, about our device and what the solution is. So it's actually multiple components cleared under different use cases. So the system itself starts with the body-worn sensor. So you can see just under the shirt of this patient, there's a body-worn sensor that's hidden underneath here. That also is using Bluetooth and connects to a gateway device currently. So that gateway then transmits over cellular networks to our cloud monitoring system that's currently hosted in AWS, but could be hosted just about anywhere. The data gets transmitted about every 3 minutes from the device up to the cloud for interrogation. And in our what we call MoMe Now mode, we can have the data transmit off the body and to the cloud every 30 seconds in more critical need areas. The one advantage of this is that it's near real time. So those patients who may be experiencing dangerous arrhythmia or having some challenges or need to report symptoms, we're actually monitoring that real time. The physician is able to get alerts when our AI algorithms trigger that it's found a dangerous arrhythmia. We have humans review it and then notify physicians. The other thing that's a little bit different about the way we do this is we have we call full disclosure data, meaning we collect every heartbeat from every patient. This is important during the review and diagnostic planning purposes that comes later on to determine whether or not the patient needs to be perhaps on a beta blocker or they need an ablation or perhaps they need to get a pacemaker put in because we recognized an extended pause in their ECG. So let's take a look at when we talk modular, what modular means to us and what it means as far as a change in the market. If I review back again, most of these devices here were designed around a single use case. Most of them in the market we're seeing here are extended Holters. So they wear it from anywhere from 2 to 14 days and then mail it back. A couple of them are communicating, but we'll get into the modular part now. So this is the device that we currently have on the market, which is the beginning of the modular approach with a gateway. So there's a separation of the electronics in what we call the pod from the lead set. So the wired lead set that connects to the body uses off-the-shelf electrodes. So you can buy those, from 3M. They're the same ones they use at the hospital when they're connecting you up for a 12-lead EKG. That pod, in this case, connects to the two other wires, and in itself, on the back of the cradle, snaps onto a regular electrode. So I'll give you an example of the advantages of having more leads in this view here is that you can see this is the same ECG at the top and the bottom, only what we've done is now I've enabled an additional lead, and that's additional vector that shows a very clean QRS and typical sinus rhythm. So if we were doing this, say, on just a single lead, the physician would only see the top here, and then in our system, not only would they see the top and the second one, but I'll show you shortly, how they actually see many more views. So the idea is to decouple the technology that's collecting the ECG from the wired lead sets, and then provide the ability and flexibility in how you collect and distribute that data. So if I move on to the next page, I'll show you an example here. So this is actually our current device has the capability. So this was one we captured with the current device, and you can see there's actually 6 leads. Now the 6 leads come from the fact that there's actually 3 electrodes connected to the body, and those electrodes each collect a signal. Then, using the principles of Einthoven's triangle, essentially you create vectors between each of those. So as you can see in the diagram, it's between points A and B, and then an intersection of C to A to B. And that's how we get a 6-lead view. And this is very helpful diagnostically. This is important when they're doing any type of therapy planning. So again, that's one of the advantages is now by going to modular, we can go to as many leads as we would like to for ambulatory ECG. So a reminder, these are not actually used in the hospital. These are for patients who are sort of suspected of having some issues. Maybe they're feeling heart palpitations. Maybe they're getting dizziness. We're really interested to find out early if they have a high burden of AFib, which could lead to stroke, etc. So these are, again, ambulatory. So another part of the modularity is the gateway. So the pod itself and the sensors are designed specifically to be modular. And the gateway is a piece of the component that's required for 2 types of studies. One of those is called an event monitor. So in an event monitor, when that's ordered, the patient pushes a button and records a symptom when they're having the particular symptom. Thank you for advancing my slide. I'm trying to keep these in sync here. So this is a effectively off-the-shelf, customized Android enterprise device. It uses 4G. It BLE connects to the sensors. It runs a secure communications protocol to the cloud from the device that we've designed for capturing ECG data in compressed packages. It has the ability also, in case the patient is out of cellular range or has no cellular coverage, we can connect locally to a Wi-Fi and transmit the data over the Wi-Fi network. Again, the gateway is required when you're into the event and the MCT monitoring modes, because one, the event, you want to capture that event and in real time respond to it. And then, as I described in the mobile cardiac telemetry, this is real time, near real time for up to 30 days where we're continuously collecting the data. Now, when I went back to the Holter, those were typically, they call recording devices. And the extended Holter is just a recording device that has larger memory and holds more ECG data. So we can deploy our sensor with or without the gateway. We tend to deploy it with the gateway always, and I'll talk about that use case in a minute. And that is that, as I mentioned, our focus has been delivering into and supplying for the main modes ordered by physicians in the U.S. healthcare system. And what generally will happen is when a patient comes in who doesn't have a history of cardiac problems, or they're really having a hard time defining or diagnosing what's going on, they'll generally do the Holter study first. So what happens in most cases with other devices is they send the patient home with that other patch, and they wear that patch for a couple of days, and then they mail that patch back, and then somebody plugs that into a computer and they diagnose it, and within a couple of weeks they get an inconclusive finding. Cardiac arrhythmias are very strange. Sometimes they're triggered by activity, sometimes they're triggered by food, they can sometimes be triggered by stress. So they don't always happen all the time. And generally what happens when people get on a monitor, they tend to take it easy. And so most of Holter studies are inconclusive. Well, that means if there's patients still having symptoms, you want to go on and do more. And to do more, you would then go to a MCT study. So what this allows us to do is we can send the device out with the gateway. We collect that 24-hour Holter data, 48-hour Holter data, up to 14 days of Holter. We process the data, And if it's in conclusion, we just send a remote command to the device and say, we're now in MCT mode. And we just continue to collect data. So there's no delay in the patient care. There's no gap in collecting ECG data. And then there's no problematic scenario where the patient has to mail it back or they have to return to the office to get a different device for a different type of test. So being modular allows a single device to cover all four of the modalities, as we call it here. And that's a key part of the modularity. So go to the next, thank you, on the next slide. What we're doing now with the modular approach is, I'm looking at my slide versus your slide. I think this is version A of my slide. So I actually have a slightly different slide, might come up next. We will be introducing, yep, I think this is the version A. So I do have a couple of different slides, and I don't know, Christoph, if you have the other two slides I sent at the very end. I think maybe there's actually just one slide missing. Can you go back between slide 11 and go back to slide 10, perhaps? Ah, there we go. Thank you. I may have missed this. On the modular approach, so we are in the process of taking this pod type sensor and submitting it through FDA for clearance for both a 1 lead and 7 lead. And so currently there's a lot of need in the market for the 1 lead. And the 1 lead is interesting. Even though we know it can be problematic, we've designed a system around it to reduce the noise because of the approach we've taken with the decoupling of the electrodes from the electronics. And then separately, our cloud infrastructure, we have a very advanced noise reduction algorithms. The 1 lead comes with a disposable cradle. It's intended, again, for that Holter extended Holter. The battery life on this will allow us to go beyond 14 days on a single charge. So we can get this, we can capture the data all at a single point in time. These are also really good for follow-up. So patients who have known arrhythmias or we're just suspected of, we're tracking to see if their atrial fibrillation burden or their AFib burden has increased. 1 lead patches are really good for that, for patients who have known non-life-threatening arrhythmias, and we're just trying to keep an eye on those, monitor those once a year. So the other thing we're doing is we're going to actually, what looks on the right-hand side, it's called a 7 lead wearable. Once again, the more electrodes you add to the body, the more vectors you directly can pick up, and then you have more intersecting vectors, like I had shown earlier on the Einthoven's triangle. And so the concept here is that with each new lead, you can pick up new vectors. And the standard in the hospital is a 12 lead EKG. And it has advantages because you can actually pinpoint from a 12 lead, and almost you can do it also here with the 7 lead, is very specifically within the heart where the problem is. So that is what's known as a precordial lead and positional electrodes. This really could become a replacement for 12 lead and give you that nearly 12 lead diagnostic capability in an ambulatory setting. So this is a case where a patient could be put on this at a skilled nursing facility. You could wear this if you're receiving home health care. A very good use case for this is for patients who are receiving dialysis. There's a lot of cardiac complications for those with dialysis. There's patients who get drug loading that can have cardiac impacts. And so this would be another use case for this where we can monitor them real time. And by having all the additional vectors, the electrophysiologist, again, can determine the origin of the arrhythmia in the heart. So it's key to be able to find out specifically where it is, and then that helps determine the therapy and ultimately the treatment plan. So go on to the last one and sort of talk about, when we talk about modular approach and what comes next. So really focus on sort of today's solutions and today's technology that we've deployed. But where we're at today is we're in the development of enabling that pod to be 4G enabled for direct transmission off of the body. So this would allow us to do a patch/pod or a single lead and or multi-lead where we could communicate directly without the use of the gateway. Now there's secondary apps we have that will allow the patient to collect their own symptoms. and that'll marry up to the system. So it'll actually be a patient-owned device rather than our specific device. But that will probably be the next iteration of the next generation pod. The current gateway supports Bluetooth connections for qualified third-party devices. So one of the things that's important during diagnosis for cardiac arrhythmias or other cardiac conditions, even patients who are being monitored for sleep apnea as well, other couple of use cases, people with chronic congestive heart failure, is that we want to collect up their blood pressure and their SpO2. So that's the oxygenation levels in their blood. The gateway itself that we have today does support collecting data from those third-party devices. So a big terminology, big talk is always hospital to home, healthcare at home, remote healthcare. There's a huge growing market for remote patient monitoring systems, and they're trying to put together all of the different devices that you need to capture to holistically cover a patient. And our gateway provides a path for collecting data from these other devices. So in some ways, the gateway, which is first designed to collect diagnostic ECG, then becomes an enabling technology for collecting up other data that may be necessary for an overall treatment plan for the patient. And so we think of that also in its technology standpoint as a way we would call it a modular design. So with that, I think that's my last slide. Thank you for going back. Hopefully my little bit of out of sync on some of these slides, everybody was able to catch up, and I appreciate that. And from here, we'll take some questions.
Well, thank you for the wonderful presentation. I do have some questions for you. So what is the expected battery life when transitioning to 4G transmitting pod? And are there plans to support 5G, make the gateway compatible with Apple devices?
Okay. Yeah, so currently our initial test with using a 4G chipset along with a custom ASIC is that we've seen up to 10 days on a charge of transmitting the full disclosure data from the pod itself. We actually do slightly different compression of the ECG data. But because our initial tests are single lead data only, that's the extent that we're getting with that. Relative to 5G, 5G is an interesting approach in the technology in that it's not needed for these types of data. We're sending really small compressed packages of data because we're not really doing any type of true video. There's not really any true video. It's really not a complex set of data we're sending. We haven't seen the need or seen any real, we call technically, improvements of 5G. What we understand from the major carriers that are available to use our device, and our device works all across the spectrum. We use an IoT SIM. The new devices use all eSIM, so they're very portable. We have devices in the Caribbean, in South America, across North America, and we've done some initial testing in Europe. The 4G network will be alive and well and healthy for the next decade plus. The question, I think also, and you mentioned Apple iOS from someone. Currently, we've developed the app on the enterprise Android platform, one, for secure reasons, and two, when we think about going to the smaller form factor, we think there's a better usability for Android Go and OS rather than sticking with the iOS like the Apple Watch. So also just going through that verification validation process and getting your app published, whether it's on the private side or the public side, we've had great success with Android. I think I got all your questions. Is that right?
Yes, okay. You did.
Okay.
We do have a question on the chat. How are the patches manufactured?
So when we move into the next gen device, what we show here is the patch. The patch itself on the backside, this gray area, is a woven material. That's actually a 3M material and adhesive. We wanted to be consistent with understanding the skin irritation profile for patients who wear these electrodes. So since you're going to be wearing this for multiple days, it can cause some skin irritation in patients. Often, that's the most common complaint from patients, is the redness and skin irritation, even from the smaller electrodes that they have to switch out every few days. So the patch is actually manufactured through a partner of ours. We actually, the clear plastic cradle that you see here, that is a clear macrolon plastic that's gone through all the biocompatibility testing. It's very inert. And then the electronics itself are assembled inside the white portion here. The very small amount of electronics is in here. And then the whole thing is put together at a US manufacturer here. And I can't disclose the manufacturer at this time, but fundamentally it's three components. It's our own design spec for the electrodes that are married to 3M substrate and a adhesive layer. And then we use this cradle, which actually marries the pod into the electrodes.
Wonderful. Yes, so thank you so much for your time today and for your wonderful presentation. Again, if you have any questions, please reach out, and he will answer all your questions. Thank you, Dave.
Thank you. Everybody have a great day. And I'll look for any emails in my inbox or my spam folder these days. Thank you.